morning, everybody. Thank you for joining us. We're having a series of these conversations throughout the community this week in a variety of different areas, and we'll kind of explain that as we go through here in terms of how the CARES Act will be impacting Douglas County initially here in round one, and how we're going to help put together a plan. So, and we do want questions and answers. So like, if you can put it in the chat box, and we've got someone helping to monitor the chat box for that, or you can raise your hand and we can move you over. And we should definitely have time at the end of this for conversation. And we did that in the one earlier the week. So please make this participatory. So we're going to give you some background on the CARES Act in general, just so you kind of all have an understanding of where this is coming from. So the next slide, please. So you're going to hear us use the words Coronavirus Relief Fund, or CRF, a lot, and then CARES Act. The CRF fund is what came down through the feds to the state. And there are some restrictions on how it was distributed and how it's put forward into Kansas and counties. So CRF funds can only be used for necessary public health expenses for things that weren't already planned for in your budgets and that were incurred from March 1st through December 30th of this year. So this is a very tight time frame. This will, it's just for this period from March through the end of the year. So there's multiple rounds of CARES Act funding, and there's multiple types of CARES Act funding going to different organizations and for different things. So what we're going to talk about today really pretty much is just CARES Act funding round one that's coming from the state of Kansas through the Spark Committee. And the bottom half of this slide talks about how the distribution formula was made. So there was a statewide allocation, including Johnson and Sedgwick counties, of $1.25 billion. The state portion without Johnson and Sedgwick was just over $1 billion. That for round one, it's coming to counties and municipalities, there was $400 million to divide between all the 105 counties in Kansas. And then they're going to be a round two and a round three that are yet to be determined. Round two, there's a lot of information out right now, and the state will be holding both of those rounds and making decisions on how those funds will be distributed to communities. Round two is specifically focused on economic development and public-private partnerships. So if you work in that area at all and there's some things you're interested in, I'd highly encourage you to read about the round two RFP that should be coming out any day now. So the allocation methodology that the state of Kansas decided was based off of what here you go. Was based upon what the federal government did for Johnson and Sedgwick County, which was $194 per person. So they took that $194 per person and gave it to, based off population, to the other counties in Kansas. And then they kept $50 million for sort of what they're calling a COVID impact amount. I don't know what to call it. And that's really based off the number of COVID cases you saw and unemployment. Douglas County actually got some funds from this because of our high unemployment. So our amount went up a little bit from some of that 50 million based off of our unemployment. So this talks about some of the allocation results by counties, different counties, if you're interested in that, and how unemployment and high COVID rates came into it. And then here at the bottom, you see that we will receive $24.9 million in this county. Next, please. So there's two pieces of this aid. One part that is reimbursement and one part that's direct aid. Now here's where it gets confusing for this particular group of nonprofit housing and human service providers in our community. So bear with me and we can answer questions on this at the end. Reimbursements, the type of reimbursement here that the governor's office and the SPARC committee is asking us to do is only available for public entities, which is not most of you. So now don't freak out. So hold with me a minute. But so the first part of the process is for reimbursements for direct entities. And there's they will pretty much bypass the recovery support function process, develop their reimbursements from what they have already incurred in terms of expense from March 1st through like today, and they will submit that directly to the county. We're working closely with all of the cities, with the public school districts, and other public entities like public health and LMH Health, because they're a public hospital, to get those reimbursements. On the direct aid side, that is a plan from now to the end of the year, but it can include reimbursements from non-public entities in that plan. So for nonprofits that have incurred expenses related to COVID-19 since March 1st, you can include your request for reimbursement of that to be a part of the direct aid plan, as well as anything you think you need moving forward for the rest of the year. So we will sometimes use the term reimbursements, and sometimes like our accounting and finance staff might get confused in this. So the more you can kind of know that we have a direct process for what I'm calling public reimbursements, public sector reimbursements, to try to clarify that. And then nonprofit reimbursement, we will funnel that into our direct aid plan. All right, so round one on reimbursements, and this is where, you know, I would say the eligible expenses for both reimbursements and direct aid plans are the same. So that simplifies things, so that's helpful. But really, so round one for the first part for reimbursements are for public entities, and it's related to, you know, we're going to show all of the eligible expenses a little bit later, but definitely what we're trying to collect right now from our public partners are what they've already spent on PPE, medical treatment capacity, testing, cleaning, any sort of emergency medical services. And then, as most of the folks in this group know who were active during our unified command process and our housing and human services incident command, there were a few community projects that were approved by both the Board of County Commissioners and the City Commission earlier this year, and those now are expenses of the city and the county because we've agreed to pay for them, and we will submit for reimbursement for those. And so I listed those, or we listed those on this PowerPoint slide as well. So the next is developing a direct aid plan. So it's supposed to be about future. So like from today through the end of the year, it can be for anything covered under the reimbursement framework that you saw before and you're going to see again. In addition, you know, additional conversations about distance learning, telework, county jails, serving homeless populations. There's also categories for small business reimbursements in that as well. There are a couple things that are really important here on the direct aid plan. It cannot cover anything that is already covered by another federal funding source. It's specifically ineligible. So if you've been working with, you know, City of Lawrence and Douglas County to help get a submittal in the emergency shelter grant process, that's not this. You will continue to do that. If you've been looking for funding and putting proposals together for CDBG, that will stay over there. We cannot cover those expenses. So this would be for things that are not covered by other sources of federal funding. These need to be, like I've said, and we're going to say it on almost every slide you see, it has to be really spent by the end of the year. And then I think it goes without saying, but just to make it very clear, these are one-time expenses. There will be there's no indication that we will get additional funds to fund these specific things. And you should not anticipate that Douglas County or the city of Lawrence would be able to fund those requests into 2021 and 2022. So I apologize for that, but this is really just one-time money to help get us back up and running a little bit. So the timeline for round one, and this is like the big timeline, and we're going to have some smaller timelines internally as to when we need specifically things by inside this. So state, the state will supposedly is going to give us a beginning part of our allocation yesterday. Didn't hear if it actually came yesterday, but we do anticipate the first amount of funds coming in pretty quickly. We're in the process of collecting receipts for the reimbursement plan from public entities right now, and then developing direct aid plans. A question that we've been getting about this all along, which is perfectly logical. So the 24.9 million is for both reimbursements and the direct aid plan. So we're right now trying to figure out how much do we have in total for reimbursements, and then we will take that amount off the top. And then the direct aid plan will be built from some lesser number. So let's say we get $1 million in requests for reimbursements from public entities. Then our new total to develop a direct aid plan becomes 23.9 million. So the direct aid program and request templates and the equity impact tool need to be submitted to your RSF3 coordinator by July 24th. And so there is we'll walk through both that program request template and the equity impact tool later in this presentation, but we really need that by the 24th. And yes, I know that is less than 10 days, and I do apologize, and I am so sorry. And if I could give us more time, I absolutely would. Every county in Kansas is begging for more time. Right now, I don't think they're going to give it to us. So please, I understand the intensity of work that's going to be required to develop these proposals and to develop your requests for reimbursement, but I wish there was something more I could do about it, but I can't. Because once you turn in that July 24th, turn it into your RSF3 coordinators, then as an RSF, we're asking you all to look at that, all of the requests together, and help us place some sort of prioritization. And I know that's super hard, and that's like picking which kid you love the best and trying to put it and trying to decide, but I fully anticipate we will receive over $50 million in requests for really great programs for this community. And then we have to narrow that down to 24.9 million that we have available for this round of funding. So, we really just ask you all to help us in this process to make it inclusive and transparent, and to try to help us develop the best way we can spend this 24.9 million as quickly as we can in our community. And then we hope once you all do that, then the recovery coordination team will see that as well, and we'll get to that group here as well. They will see the whole plan, and then it will be submitted to the Board of County Commissioners for approval on August 15th. We may have some special meetings in there to review all of this with the commissioners. They agreed last night that we may need to get some special meetings together to help review all that, but we are on a very tight timeline to get it to the state. All right, here is the lovely slide that tells you a lot of ideas of things that are eligible and the framework in which the state has put it for us. So the state has four focus areas: health, connectivity, economic development, education. And then they have listed some investment ideas, so i.e. eligible expenses by county objective. The first one really goes back to reimbursements. You know, we want to make our public institutions whole that have been helping us through this process from March 1st to where we sit here in July. We want to protect the health of Kansans now and beyond. So testing, medical supplies, contact tracing, telehealth, infrastructure grants for hospitals and clinics, food distribution, you know, programs to care for homeless populations, school-based mental health. You know, there's a lot of really great project ideas and in that column as well. They do want to ensure that businesses and nonprofits can reopen safely. So that really, again, goes back to PPE, supplies, digital thermometers, all that jazz for both nonprofits and for businesses. And then the last column, I always have to keep moving you guys around to see things because I can't. Building resilient communities. So we're trying to really plan for what things will look like here for the next 6 months. So what can we do in terms of, you know, additional stockpiles of supplies or investments in distance learning so that we can continue to keep our community strong for the next 6 months. And this really was, this is all of these PowerPoints that you pretty much seen so well, like these ones with the color on them, all come from the state, and they're straight out of the state municipal toolkit and the state Spark PowerPoints that they put together for us to review. So here's our COVID recovery response team. So, you know, and a lot of you know this because you were active in the unified command process over the last several months. We had unified command, and we all thought kind of in May that maybe we could step down from unified command because we had things under control and we could kind of move into recovery and response. So we put together this framework before we knew we had CARES Act funding. So, and this framework will continue after we develop CARES Act funding to help our community continue to recover and respond to this epidemic. So at the top, you know, kind of emergency management is helping us lead through this process. The team leaders, and sometimes you're going to hear me call them the coordination team leaders or recovery coordination team. We made that choice very specifically to move from unified command to coordination, and the words that implies, that now we're really in a coordination effort as opposed to a command effort. That includes myself, city manager, CEO of LMH Health, Public Health, Chancellor Gerard at the University of Kansas, Bonnie Lowe at the Chamber, Dr. Lewis at the USD 497, and our County Health Officer, Dr. Thomas Marcelino. And then directly off of that, we have a number of functional areas that continued with us from Unified Command, such as logistics and finance and public information officers, but we also added equity impact advisors and an equity impact team to each of the RSFs. And that was a conscious decision to make sure that as we move into recovery, that equity is at the top of our mind as to how we approach this work, and how we can make sure we're infusing that throughout this process. So the coordination team has an equity impact advisor of Casey Toomey with the city, and then each of the RSFs have embedded in their RSF equity advisors. And so, and here you go. So here are the 4 RSFs. So RSF is recovery support function. And the first one is economic recovery. The chamber is leading that effort. The next one is health and medical services, and that's led by Beth Llewellyn at Public Health and Tracy Hoopen-Gardner at LMH Health. Housing and Human Services, which is this group, and Jill Jollikers is leading that with help from Shannon Owery. And then, oh, can you go back a little bit? I'm sorry, you're moving too fast for me, Jill. And then the last one is education. And that's led by Julie Boyle at USD 497 and Andrew Foster at the University of Kansas. So there's been, and I think we can stop here for some questions before we dive into housing and human services if folks want to do that. And then But I do want to say with these groups is, you know, we really felt like this was a broad section of the areas that need to be represented in this process, but there's clearly a lot of overlap. You know, education is talking about testing for students and, you know, resources for school nurses. Well, they may work closely with health and medical for putting a proposal together. One of the things that health and medical is looking to do is continuing to fund a resource from public health for housing and human service providers like we had before. And so, you know, there can be a lot of cross-pollination inside these 4 areas. So, you know, think about that as well in terms of the kinds of things that you want to put together for your proposals on the direct aid plan. So I think there was maybe a request to take a quick pause for questions, or so I'm open to whatever.
Yeah, this is Jill, throw any questions that you have at this point in the chat box. We can do that before I dive into the Housing and Human Service RSF3 focus group. Anybody have anything at this point?
Yeah, and you can either raise your hand and we can move you over and talk about it, or we can dump it into the chat. Yeah, we'll get you the slideshow out, sure, and most definitely.
The slideshow, and this slideshow is actually already available on the county's website, and we'll get you a link here soon. And after today's meeting, we're going to, we wanted to get through Tuesday's meeting and today's meeting to then send out all the final materials associated with these sessions, including we have an updated template that I'm gonna stop screen sharing here in just a couple minutes after some slides and pull that up here. An updated direct aid template that we got from the state yesterday, which each of you are gonna be asked to fill out if you choose to submit one. But keep throwing questions in the chat and we can come back to it.
Yeah, so Jill, why don't you go ahead and talk then about the goals of this RSF, and then we can keep it moving.
Okay, well, thanks, Sarah. A lot of you on this call have been involved in RSF3, Housing and Human Services. I've pulled up, and a lot of you have seen the planning document that's been circulated to the group multiple times in our different planning meetings that we've had. Our group's probably only met, I want to say 2 or 3 times as a group, as a large group, but we have small group meetings amongst a lot of the stakeholders in these focus areas throughout the week. And that's an extension of the ESF6 function that was the groups that organized around Housing and Human Services during the Unified Command Response. So a lot of us have become, if we weren't friends already, we're a lot better friends, and a lot of great ideas and renewed energy to do some good work has really emerged. And I think you'll find that here in these focus areas. So the first one, I'm not going to read everything on here because you can see that here, but our larger goal is to restore and strengthen social service capabilities and networks to promote recovery and resilience. Obviously, recovery is kind of a hard term to stomach right now because we're still kind of in response phase. So we're mindful of that. But diving into the focus areas, the first one is housing, stabilization, and homelessness prevention. So at the core of this, it's making sure that we've got coordinated access to rent, mortgage, utility assistance. We know that the eviction rate is just, it's going to be a significant burden on our community as those continues to rise. I don't know if many of you are aware, but you probably are because you work with a lot of vulnerable populations. But with the district courts just starting to open up, we do anticipate seeing a significant rise in eviction proceedings. And with the federal protections ending this month, we know we need to get organized. And I know there's already a good group of stakeholders that are organizing around this particular focus area. But then we're also looking at things like integrating housing and financial legal counseling services for renters, and to make sure that we're not only we're warding off potential evictions or issues for folks that, but for COVID, may not be in the situation. And then an ongoing area has been just trying to convene some better improved conversations and hopefully develop strategies with landlords and property management firms. That's kind of been an ongoing issue, especially for some of our more challenging populations to house. The next one is, the next two are largely an extension of efforts from the Unified Command Response, which is focused on healthy congregate living and shelter environments. And that's just making sure that our local agencies and shelter congregate living environments, organizations like LCS, the Willow, Cottonwood, DECA, all have ready to go access, or as improved as possible, access to PPE and guidance from the health department that's relevant and timely. And that's, so this area in particular, we really do feel like we're kind of just in a monitoring phase. We've got a great relationship with the health department, but we do have to stay vigilant and continue to monitor it. Third focus area, very similar situation in terms of monitoring, that's community food and feeding supports. This again was an area of focus during ESF 6 that many of you were involved in. Kind of our lead agency with this is Just Food, and we're working closely with them, but also, we really, Just Food has such strong relationships with a lot of the other community feeding organizations. So we, in partnership with Just Food and some of the contacts we have with other feeding operations, we feel like we are providing the best guidance that we possibly can during this time, but we'll continue to monitor it. And then our last focus area is the unsheltered homeless services. So many of you may know that we've ESF 6 with the help of with Bert Nash and the Lawrence Parks and Rec Department worked hard to make sure that the Aquatic Center has remained open at least 2 days a week over these past few months to make sure those basic hygiene needs and showering, laundry are provided for our unsheltered homeless population. But then, so that's kind of just how we need to make sure we maintain that. And then the next one is, how can we develop a plan to implement designated legal spaces for camping that also include those hygiene opportunities that I mentioned in the first bullet. So efforts have been underway with the City of Lawrence and with other nonprofit agencies to understand what we would need to do to operationalize that idea. Because we know best practice in other communities and recommendations from the CDC and National Alliance on Homelessness is that to effectively respond to COVID-19 and for the unsheltered homeless population, you've got to have some sort of an organized approach like this, to make sure that you're warding off any kind of a community spread or outbreak in this very vulnerable population. And then our last bullet is, how do we sustain and possibly enhance our efforts to assist the homeless and precariously housed individuals and families in getting them as timely access as possible to affordable housing and rapid rehousing opportunities that exist in the community. And that is RSF 3. And so at this point, let's see, I have, I'm gonna send it back to Sarah for this part, if that's all right, Sarah.
Yeah, and then we will pop up, after we get like through this slide or so, then we'll pop up the direct aid template. So next steps, if you have a program, project, or expense that you want to submit for the direct aid plan, there's a couple of ways to go about that. But the first thing would be complete a direct aid template, which is on the next slide, and get it into Jill by 8 a.m. on Friday the 24th. Really, no exceptions, guys. Like, we got a really tight timeline to get this all together for the whole community and get it to the commission. And then we also are asking folks to complete a racial equity impact tool and submit that at the same time. And then this group will meet again on Monday, July 27th sometime, to talk through, to review, to see everything that everyone's turned in and really try to help us prioritize some things that can go to the commission for approval. So the next slide is the template. So it is an Excel form, and you know, do you have the actual one where we can scroll through, Jill?
I do. Give me just a minute. I've got to pull, I'm going to have to stop share for a second. So it might be a good minute to,
Ask some initial questions if folks have,
yeah.
they want to put in the chat.
Daviana, if you could help with those, or Sarah, you can see them too.
Yeah. We're so good at discussing things. No one has questions. Um, and then, maybe while she's pulling this up, it's really a pretty simple Excel template to develop your direct aid plan. And then the equity impact tool is just a fillable PDF. So, and they're both like pretty much just one page. So the submittal part's pretty easy. We have an idea of what the reimbursement spreadsheets are going to look like. So we can share that with folks as well. So that once you do your direct aid plan, and let's say it's approved by the state, then you will be submitting for reimbursements through the county based off of what you have in your direct aid plan each month. And the spreadsheet for that reimbursement process is pretty extensive, but not too bad for those of you that have done significant grant and accounting work. So that process will go, we have to collect those then each month. Some other questions we're getting from groups in terms of how things are going with this. So let's see. Capital could be done as a part of this, but it needs to be done quickly. So it would need to be a capital expense that could be done and secured by the end of the year. Obviously, I think the commission, in terms of how it's going to set priorities, it's going to be difficult. We anticipate getting lots of asks that we can't fund. So we really ask folks to be understanding in that regard. This is not the only source of federal funding that's going to be coming down to Kansans and communities. So please, think through if there are other funds that you think are coming or know are coming. Our goal is to try to leverage as many federal dollars as possible for our community. So that's another reason why I think if organizations have access to another pot of significant federal funds, they may not get everything they hope to get out of this 24.9 million from the county. We have added this to our coronavirus website, and we are really trying to make this open to the public in terms of submitting ideas and being transparent in the development of this process. But the time constraints are really what's holding us back here. Most of you know, if this was something that we would normally do in this community, we would create a task force and spend 6 months doing surveys and focus groups and putting together a really thoughtful, deliberate plan that would meet all, which would touch every part of our community. And I just don't have that kind of time. We have a very tight timeline to turn this around. What happened, I would also say that, and Jill, interrupt me at any point in time, because I am stalling for time. We highly encourage folks to collaborate on projects here. And nothing else to help you all, but then to also help us. And we have heard, Douglas County Community Foundation is more than willing to get engaged in this work and help nonprofits and other community organizations manage this process. So let's say there's 3 or 4 of you that are thinking about something real specific in terms of additional rapid rehousing dollars or some sort of supports like that. If you're all thinking the same thing and you can find one entity that's going to be willing to help keep the administration and help manage the receipts and the reporting, that I think is not only helpful for you all, but it's helpful for us as well in terms of submitting this, because we will have hundreds and hundreds of different organizations trying to submit for reimbursement, and it all has to come through the county. Normally the amount of federal funds the county gets in a given year is somewhere between 300 and 400,000. So this 25 million in 6 months is really also overwhelming our finance system and our ability to maintain the projects. Okay, so here is the Excel sheet. So on the first tab, it really has a lot of summary information just related to definitions and so forth. So and there is a whole instructions tab. You're more than welcome to look at that. Planned independent expenditures is not for outside agencies, that's for the county. So you can pretty much ignore that tab. And then Jill, maybe going to the example program is a really good place to start. So here the state has given us a sample program. Isn't that nice of them? So, you know, from Test Town Chamber of Commerce. So they've filled this out to sort of give you a sense of what the type of program and the information that they're looking for. Everybody, you know, as you go down to the questions below on the program details, some of them are drop down menus to pick something from. Really, if you could scroll down, Jill. You know, the program and project descriptions are pretty short. You can expand them. You know, it really just asks you of just a few questions. Keep going. And then really it just wants a sample proposed budget. And what I would say here that's important for the group to understand at this point. So it'd be really easy, I think, for a lot of us to say, well, let's just aim big in terms of what the project budget should be like. And that way we don't miss the mark. So, but remember, we're putting this into our direct aid plan. And when we put it in there and we say, if this program's going to cost $100,000, and you really only end up spending $50,000, in essence, we've included that in our direct aid plan. If those funds are not spent for that purpose, I don't really have a lot of indication at this point in time that I can say, oops, can I take that 50,000 and spend it on something else? We've really committed it to this project area. So I would ask folks to try to keep their estimates as realistic as possible, knowing that it's just so hard in this environment, and trying to anticipate what expenditures are going to be like. So right now I don't have any indication that they're going to let us, you know, mid cycle say, can we take that 50,000 and put it on something else? And then so each tab here, then there's just a sample blank program tab after this, and you can make as many copies of that program tab as you want, and just fill it out. And we're asking the RSF coordinators to come up with like a numbering mechanism that will tie your Excel sheet to your Adobe sheet for us to review and consider. And maybe you want to pull, could you have access to be able to pull that one up?
Which one?
The equity impact tool?
Yes, give me just a second. And there's a few questions while I'm pulling that up. There's a few questions in the, so scroll up, Sarah, to.
Yeah, so one question, sorry, Jill.
You go for it, you do it.
Does the hub link have and host both of the mentioned documents?
We can get it on there. If not, Jill will send them out as well. If you had access to our SharePoint site as a part of Unified Command, they are on our SharePoint site. So if not, I know we'll send them out.
And then another question is, Cottonwood will be interested in testing availability. Would that be something that would be submitted for several agencies to pull together and have available?
Yeah, I would say, you know, Sharon, you should talk to public health about, you know, what would that look like? Who would, you know, are there agencies that would benefit, that would want to be together on that? And then the question comes, should that be in this RSF or the health and medical RSF? I don't think it really matters. So wherever that group decides that it wants to put it, I know that public health is working on a pretty large, you know, program detail in several areas. So I would suggest reaching out to them and talking about how you can partner with them moving forward.
Dana asks, can funds be obligated past December 31st, 2020 For example, HSC Bridging Home rental assistance per month past December.
So I would say no. We have some indication from the state of Kansas that if you have it like a construction project under contract, that we can submit receipts into the first quarter, but I don't think they're going to want to pay for what I would consider ongoing expenses for January and February. Now, there seems to be some differences of opinion on this. I know Wyandotte County is working on some things that would go into next year. I honestly, guys, I don't know the detail of what they're working on and if they have other funds they're bringing into play, but for purposes of what we're trying to plan here, we really just need to think through December. Now, and remember, I know with round 3 of CARES Act funding, anything that's not spent by counties in this phase is going to be swept and put into round 3. So, I do think that there'll be additional rounds of funding available in the future that for access, but I think for purposes of what we have here, it's December.
With the caveat, I think that, that what they have given us guidance on is if it's contractually obligated by the 31st, but paid out.
Yeah, that's what I said. Yeah.
For the first quarter, it has to be paid out. So Dana, thinking about that program, if you had a contract in place with a landlord, and you could commit to payouts through the first quarter, that would be all we need. We would ask you guys to provide, any agency to provide receipts.
Yeah, and Jill, let us clarify that, because I think it's one thing to say it's going to have a March date on it and we're going to get it filled out and turned in March. I think what they were intending was we will give you through the first quarter to pay for things that happened in the last year. So we're asking for clarification on that, but okay. I'm not sure that we can pay for 2021 expenses. We can pay for, I believe, expenses that were incurred in the prior year in the first quarter.
Okay.
But let's,
one of many questions and things we're trying to seek clarification on from the state.
And I would say that, so on those questions, so the state's been, I feel for them because, they're working so hard to get stood up and to do this work. And they have said they will have resources available to counties to answer questions like this. It just hasn't happened yet. And we know the clock is ticking. So, and those of you that know me know that I don't want to push the envelope here because I don't want to risk these funds not being able to stay in this community when there's a lot of really valid needs. So, if we find out that we can do something that gets us into 2021, we will certainly let folks know and do that. But, right now, I think the best guidance we have is to figure out how we can spend these funds this year.
I think one question that came up related to this in the last session too was regarding can these funds be used for administrative costs? And the answer is yes, but not a large amount. It's just
Don't go crazy. But yet we also know it takes admin to support these efforts. So I think we've been told we can pay for that. We've been told like we can waive Davis-Bacon for selection of contractors and so forth. We don't know that we can waive all vendor selection, bidding, RFP processes, but we are trying to find that out as well too. We will have, for every entity that is in the direct aid plan, we'll complete a agreement with Douglas County saying that they will do what they said they were going to do in terms of how they were going to spend the funds and submit receipts. And we're working already on that template now so that we have that available as soon as we're able to get this direct aid plan together. So here is the COVID-19 rapid response tool for racial equity impact analysis. And this is like just a cover sheet that kind of explains the instructions for the tool and what we're asking folks to do with it and some definitions. And then I'm really very thankful for the equity advisors creating a pretty easy, one page, streamlined analysis to help inform your decisions, your recommendations as you think as an RSF, and the recovery team and the Board of County Commissioners review of this as we put it together. And as you can see, it's really simple. It's just, what's your proposal? What are the outcomes? What areas does it impact? Who would be benefiting? And are there strategies, you know, to mitigate any unintended consequences? And so it's pretty straightforward, pretty should not hopefully give folks a lot of trouble in trying to figure out what we're trying to get at here. And we're asking for this racial equity impact analysis for everything associated with the direct aid plan. So each RSF will be using this: economic impact, health and medical, this one, and education as well.
So I went back to this slide just as it's a nice reminder to everyone. Now that we've showed you the template, we've showed you the direct aid template, we've showed you the racial equity impact assessment tool. Those, if you think that you're going to be submitting, those are the things that you need to be making sure that you have submitted by 8 a.m. on Friday, July 24th.
No, I still
go
have
ahead.
your Word file up. I don't see
What's
this.
that? Oh, I'm sorry. My new share. Sorry about that. There we go. Okay, direct aid plan next steps.
Yeah.
Okay, sorry about that. Thanks, Sarah. I just wanted to remind everybody, so next steps, if you have questions, if you're not sure, if you haven't, the idea, the proposal that you have for a direct aid plan, you're not sure whether or not it's viable or not, or it's going to be workable, you can always reach out to me. You can reach out to Shannon Oury with the Housing Authority. She's my partner in crime on RSF3. And when we showed you the chart of the other RSFs, if you think that the proposal that you have may have an intersect or be related to one of the others, you can reach out to any of those coordinators. And if you need contact information for them, please reach out to me. But I've already had a couple calls with folks, some of you and others, and I'm happy to talk that through. And Sarah mentioned this, but again, our RSF is going to be myself, and our RSF is going to be, has our next regularly scheduled meeting on Monday at 2. And we're just kind of going to regroup and make sure everybody knows what the next few steps are going to be. But then Shannon, Shannon Oury, the equity advisor, and myself are going to be working really hard on Friday the 24th to look at all the proposals that have been submitted and providing an initial priority rank that will, high, medium, and low, that will be the initial recommendation to the RSF3 group that will meet again on the 27th. And we will hopefully get their buy-in and approval to move forward. And I need to update this slide. I apologize, Sarah. There's a step in between there that it'll go to the leadership team for the recovery framework.
Hey, Jill, we got a couple questions in the chat. So Anju was asking about the second round. I want to be really clear here. So the second round is not, the county won't run it. The second round is, and the third round will be run by the state. The second round is focused on public-private partnerships. I don't know hardly anything about it because I've been focusing on this round. So but I know that it won't come to the counties. So there, as far as I know, this is the only round that the county will have direct oversight and control of. Mike, you were talking about payroll expenses. So like we can get into this from what I'm reading, and I will check with our folks on this. The payroll expenses, it needs to be public employees whose time was significantly dedicated to COVID related expenditures. So I'm not sure, Bert Nash, I'm not sure how that would be looked at, and that's definitely something we can try to get clarity on. One of the things that we were also hoping to get clarity on from the state, it says specifically that the funds can be used to shore up revenue losses related to business interruption for businesses. My hope that would also could be nonprofits like health providers like Bert Nash and Heartland Health. So we're trying to find that out and get those answers back to you. So please stay in touch with us on that. I don't believe entities need to be a 501c3 to apply, but they need to be able to comply with the requirements that we're setting forward here. But I would say that if folks want to, if it's not a group that has that infrastructure, that we really would hope that they would collaborate with another community-based entity to help make that work happen. You know, and like Douglas County Community Foundation, or, you know, the example I used a lot in the last one is like the Lawrence Restaurant Association and restaurants. You know, there's probably 500 restaurants, let's say, in Douglas County. My hope is that instead of getting an individual program, direct aid plan program detail from 500 restaurants, my hope is that they work together and submit for a pool of funds, and then the Lawrence Restaurant Association helps them complete the paperwork and record keeping for us, so that we are not dealing with 500 restaurants. The same thing I think could happen here inside RSF3. We're talking about an education with like home daycare providers and other early childhood education providers. Those are some examples of, you know, some natural areas where there could be some collaboration.
One thing I wanted to share somewhat related to Mike's question, and this relates to everybody. I'm going to make sure that we add a link, or I probably will provide a link to the Kansas Association of Counties website, where there'll be some links to some presentations that were made yesterday from Department of Children and Families and KDADS, specific to areas of community mental health, behavioral health, health and human services, and I just kind of idea forming and resource provision about specific to that area that I think everybody on this call would be interested in hearing about, and maybe some other opportunities that folks weren't aware of.
Any other questions that anybody might have? You know, I know we're kind of getting up on an hour here, and I want to make sure we're respectful of everybody's time. You know, I really appreciate everybody's time and attention into this, and I'm super excited to see all the great ideas everybody has for how we can really help our community continue to respond to this. It's, you know, for those of us that have been involved in this since the beginning, there's some very scary days where we weren't sure that there would be federal funds that would come to us locally, that we would be able to help, you know, patch up, you know, the expenses that were happening here locally. So I'm excited about this. I'm also daunted. And I really ask for people's understanding and support here. This is a time where understanding and support seems to be a little thin, but we could really use it. That this is, you know, we just don't have much time. And I know that's compressed, and oftentimes good decisions are not made in short time frames, but that's where we are here today. And my hope is that, you know, the county commission understands that as well. They want to be very engaged and involved in this process. So, you know, please just let us know if you have questions or concerns, or if there's something coming along the pike that might throw you a curveball. We'll just do our best to try to accommodate it and ask for your guys' understanding as we go.
Thanks, everybody.
Yeah, unless somebody has anything else.
Yeah, you know where to find us. Oh, Patrick raised his hand. Let's move you over. Let's see if you want to. Can move you over, Patrick, if you want to.
Sure. I just said, I joined late. I had another meeting, and I just put this in the chat. Is this recording going to be available so I could view it later today or tomorrow?
Yes.
Okay, thank you.
I'll hopefully get it up this afternoon along with the link to Tuesdays as well, Patrick.
Looks like
the PowerPoint's already there though.
Okay.
On the county's website, and I'll send y'all a link to that. I am terrible at multitasking when I'm on a laptop and a Zoom. Otherwise, I'd be putting that into the chat, but I'm not that good.
All right, well, thanks guys. And please let us know what questions we can answer and how we can help you over the next couple days as you put all this together. Thank you.